Good morning, Patrick here from Complete Health. And I just wanted to go through some stuff that obviously get asked to me on a really regular basis. So, chiropractors, what's probably the most common thing that walks through our door? Well, 99.9% of people probably think of us as back doctors, so that we fix problems with lower backs, necks, whatever. So yes, one of the most common things is probably back pain that we see in our clinic. But the reason why this is such an important thing is how heavily interlinked it is with other things. So there are really kind of three different tissues in the lower back that will be really linked in with these kinds of problems. But then we also have to ask the other question, is what can damage to these types of tissues start to lead to if we ignore them for long enough? So really the three main tissues that are in the lower back, that will trigger people's pain and symptoms are going to be down to one of the three following things. Soft tissues, e.g. muscles, ligaments, cartilage, etc. Bones themselves, or nerves. Now the thing is you can never really isolate any one of these three things, and the reason why I say this is that when one of them becomes damaged, inflamed, or irritated, it almost always attacks the other tissues in that area as well. E.g., if I start to degenerate and wear my joints out, e.g. the bones start to develop spurs, you can almost always guarantee that a soft tissue, e.g. something like cartilage or a ligament or a muscle, has been injured at the same time. Well, the main reason why we can almost guarantee this is that in order for the bones to start developing enough friction that they want to develop spurs, either a soft tissue has to pull or has to be damaged so that the bones can rub to create friction so that those can actually then start to take place. Now, if those patterns are starting to take place, what is the thing that's controlling the muscles, the ligaments, the cartilage, and all of the other stuff that's sitting in that area? Well, it comes from the nerves. So if the muscles are imbalanced, the main reason why this is occurring is because the nerve is sending the signal for us to do so. So when we look at a low back injury, people will quite often ask us, why is it that you're always looking at other areas other than just where the problem is? Or why are you not only adjusting the low back? Or why are you not only concentrating on one thing? Well, the main reason being is you always have to look at someone as a whole. If someone is coming in with low back pain, is it fair to say that if their joints are injured, they are going to need some sort of strengthening, flexibility work, as well as obviously spinal adjusting, as well as teaching them how to stretch, as well as teaching them the right nutrition in order to calm down the tissues, the inflammation, etc. in that area. All of these things are true. We can't isolate it to one of those things. So, like I said, realistically, whenever we look at a low back issue, you have to look at one of the three things, or a combination of all three things, and start teaching someone how to retrain all three of these areas. So that's making sure that bony alignment is good so that the tissues in the bones don't start to become irritated. Making sure that the soft tissues are both flexible but also strong enough. Now, I can use a prime example because people will always ask, well, how can you have flexibility and strength at the same time? Well, just look at a gymnast. Some of the most flexible people on the planet, yet they've got some incredible strength for holding in some incredibly awkward positions. So we need to make sure that we have the adequate strength and flexibility in the tissues surrounding the spine. And then we also want to make sure that those neurons that are sitting down in the base of the spine are firing the way that they should do. Now, typically when you start moving the spine, it will allow for flexibility in the muscles. It will also allow for movement of the spine, which stimulates the nerves. So we start to strengthen the pathways in the nerves. Now, if we strengthen the pathways in the nerves, guess what? The nerve is sending the signal to the muscle. And so we can start to see improvements in the strength of the muscles by moving as well. And if you move more, guess what? Your muscle gets used more. And if it gets used more, guess what? It builds strength. So the reality of it is true is you can't isolate. You cannot isolate because people always go, well, what's the most common cause of low back pain? Well, there isn't one. Because the thing is that they all become intertwined. And so when habits become chronic and we do the same things over and over again that are triggering the injuries, this is when the mess then starts to begin. Now, when things degenerate enough, then we will start to lose muscle strength. We potentially start to lose our cartilage, our soft tissues. we tend to start developing spurs. And if this starts to happen, then we can start to see damage to our nerves and our neurons. Now, this will obviously start to cause things like lower back pain, potentially stuff like sciatica as well. But it can go even a step further. If we damage the nerves in our low back enough, it can even start to lead to problems with our bowels, our bladder, and other organs, as well as our senses around the legs, the lower back, etc. Which is why if you start to notice sciatica, you have to start wondering, why are my nerves starting to get damaged? So if you're suffering and you're not doing anything about it, I really do urge you to take a further look, even if it's not necessarily with a chiropractor, it could be with a physio, it could be with your doctor, but do not let yourself get into this cycle of only taking painkillers to try and resolve the lower back pain, because it's never actually addressing the cause of the problem that could be there. It is literally just masking a symptom. So unless you get to the root cause of what is going on, there's a chance that tissue can be led to degenerate. It's a little bit like having a leak in your sink, and as opposed to fixing the leak, you just put a bucket underneath it. It solves the problem short term, but it is not a longer term solution. If you need any advice, always ask that you just leave comments or send a message to the clinic, and we can potentially send you in the right direction. Patrick here from Complete Health. I hope you found this helpful. I always put these back onto our Facebook page so that you can get them as a replay. They also go back onto our YouTube channel, so if you ever miss any of these videos and you want to catch up with anything, then they're all stored on our YouTube channel, which is Complete Health Eastbourne. Patrick here from Complete Health. I'll speak to you again soon.